Well, thanks for coming. We're here to talk today a little bit about a project that we've been working on at OCLC called Public Libraries Respond to the Opioid Crisis with Their Communities. My name is Kendra Morgan, and I've been the project director for this activity, and it's been a great project. We've learned a lot, and I'm excited to be able to share a little bit with you. So this project was a partnership between OCLC, the Public Library Association, and we received a grant from the Institute of Museum and Library Services. This really started back in 2017. After ALA Annual, we heard from a lot of participants that they were really interested in learning more about what was happening with the opioid crisis. And then we hosted a town hall, and this was an online activity where we encouraged people to come and hear from frontline library staff who were responding to the opioid crisis, from partners who had resources that might be helpful to libraries. And when we listened to what participants said, they really wanted to have more. They wanted more information and more opportunities. So we put together a grant proposal for IMLS, and that was funded and resulted in this research. Within OCLC, it was a great opportunity to bring together two teams from our membership and research division, the Library Trends and User Research team, and the team at Web Junction, which has a focus on continuing education for public library staff. We also got to leverage the strengths of our colleagues at the Public Library Association and the reach of both of our organizations into the field. These are just a few images from the libraries that we worked with and created case studies on. And what you'll hear as we go through the session is that there's a tremendous amount of variety in the responses that are happening, and it's really community-based. It's based on what people need, what the libraries are capable of delivering, and what their partners might be able to contribute as well. And it's a great way to emphasize the fact that there is no one-size-fits-all solution. Everyone can take the time to figure out how best to pursue a response and work together with partners to do that. So I wanted to touch really quickly on the 8 case study sites that we worked with, starting up in Washington all the way across the country to Rhode Island. And it was a great range of communities, from 16,000 all the way up to 800,000. And the demographics of these communities were very different. The socioeconomic background, the interventions that these libraries implemented in their communities. And that also speaks to the variety and the needs of their communities. Some people saw an acute need, and others wanted to help reinforce the importance of providing prevention and treatment support. The interview protocol for this project actually had us working not only with the library staff, but with the staff from partner organizations. So we interviewed library staff, we interviewed a board member from the library, and then we interviewed up to 2 members of the partner staff as well. We also worked with up to 3 community members who actually attended programming that the libraries were offering to hear their perspectives, and that was really enlightening, and you could tell from these interviews just how impactful the training opportunities were. So I touched on the case study research, but there are also 3 other buckets. The cross-sector discussions, which I'll talk a little bit about, a call to action white paper, which we'll be releasing in February just before the Public Library Association conference, and then ongoing dissemination to the field, which are events like this. We're also doing a series of webinars. We've done 2 so far, and we'll be doing another one in March. 8 libraries that we profiled in those case studies, there were 8 types of programs that really surfaced. Many of them were doing more than one thing. The most common response that we saw with libraries and their partners was naloxone training, not just for the staff, but for the public as well. And in Salt Lake County, Utah, they have a really unique situation where they're actually distributing naloxone to the public and making that available to anyone who walks in. But there's a great program happening in Blount County, Tennessee, where they're actually partnering with their local recovery court to offer life skills training to people who are participating in the recovery court process, which are people who have received jail sentences as a result of a drug offense. And so now they're coming into the library and receiving training on typical things that libraries do every day. And the library has really been able to leverage that partnership to meet an important community need. This is an example of an overdose rescue kit that's available at the Peoria Public Library, and it includes 2 doses of naloxone. That's the Narcan nasal spray. It also includes instructions on how to get additional help. One of the key things that we heard from every library and every partner that we worked with who was using and making naloxone available is the importance of following up with emergency medical response. Naloxone just buys you some time and helps to revive someone in precious minutes, which is critically important. But we also saw other libraries that were working with naloxone in a different way. And this is a program at the New Orleans Public Library called the Bystander Response Training. And I really appreciate this program because it pairs naloxone training along with CPR, which is a common first responder type of activity, and another program called Stop the Bleed. So anyone who comes to those sessions has the opportunity to learn 3 life-saving techniques. So this is a quote. I mentioned that we interviewed community members as part of this project, and the individual shared with me during the interviews that they felt more prepared because they'd had this training, and with that preparation they felt like they were more likely to help, which is an amazing skill and thing to be able to pick up at the library. This is a campaign that is available in Utah, and it's called Use Only as Directed. And this campaign was something that the public library participated in. And this is actually the checkout desk to one of the Salt Lake County libraries. And they put this wrap around it in order to call attention to what opioids look like and to make people aware of the fact that opioids can cause a physical dependency in less than 7 days. So they really want to encourage people to have conversations with their doctors about alternatives. And when you first walk into this library, and you can see all these little pill bottles, they have 7,000 pill bottles hanging from the ceiling of the library and available. So when you first walk in, it takes a little bit of a second, and then you can see what you're looking at. And all around the room is information about how opioids, an opioid dependency can be treated, how to seek help, and helping people to become more informed about the importance of being educated around opioid misuse. The 7,000 pill bottles were done because that's the number of prescriptions that are filled every day in Utah. This is a program with the Twinsburg Public Library in Ohio that they are doing in partnership with the Summit County Community Partnership. And what is great about this program is that people can take one of these doTERRA drug disposal deactivation bags home and put any unused or unneeded medications in it. They can fill it with water, seal it, and then it can go to a landfill. And then that's safely getting rid of any unneeded medications so that they can't be misused in the home. That was a big part of the Use Only as Directed campaign. A lot of libraries are participating in letting people know about drug takeback programs, which are available at many pharmacies and police departments. But this was a unique way to make it available for an individual to take home. And then we have the more traditional library services that we're familiar with. Many libraries around the country have hosted talks around Dreamland, which is a book written by Sam Quinones, and they're hosting community talks and discussions about the book. Quite a few states have brought in the author to provide workshops and talks. Author David Sheff was at the Everett Public Library up in Washington talking about his book, Beautiful Boy, which is about his son. So some of the outputs that were reported by the libraries and their partners with regards to success with this program were increased community resources. So there was Narcan out in the community, there were more books about a topic, there were resources and pamphlets available to help people learn more. I really appreciated that it was an opportunity for the library to develop new partnerships and of course an increased positive perception of the library. And really importantly was the opportunity to address stigma. This is a really problematic topic in some communities, and people are looking for ways to find information, and if they can do that in the library in a non-stigmatized and safe place, that's really helping the health of the community. So one of the more interesting parts of this work was cross-sector discussions. It was one of our major project deliverables. And this brought together about 40 different organizations in the fall of 2019 in online convenings. And the purpose of those was to share with people from outside the library world a little bit about what was happening within libraries that might align with the work that they were doing. So we invited a lot of medical organizations. We had some nonprofits that work in recovery. The National Summer Learning Association, which has a lot in common with libraries, as well as the National Recreation and Park Association. And these were opportunities to share the case studies that we had developed along with a summary report about the research and have a chance to share that with them. They were all really enthusiastic about what they were learning, and they could see the alignment with their own plans within the communities. And it also was a chance for us to hear from them about how we might be able to share their resources with the library community. They've developed some really great things, and we know librarians are always looking ways to not reinvent the wheel. But we're going to be elevating some of these resources that we found out about in the call to action report that comes out in March. So that call to action will have 5 key steps to it. And these are all recommendations that we want all libraries and communities to take a look at and see how it might align with their community needs. So the first is exploring the community data. What can they learn about health data, about the demographics in their community? It may not illuminate a particular concern around opioid misuse, but you may find out other things, and it's a great way to make some new partnerships around an important topic. Considering community assets and connecting with partners is a great way to learn a little bit more about who's in your community. We do this on so many different topics, so this is a great way to take some intentional time to investigate new partnerships. Increasing awareness and knowledge among the staff and the community. This is one of those opportunities to help reduce some of the stigma that's associated with opioid misuse. Focusing on library staff care is a really critical part of this. Sometimes these events can be traumatic. They're rare, they're very unusual, but what plan can you have in place to make sure that you can support staff if something does happen? And that's an important thing to consider on so many fronts, not just with the opioid crisis. What resources are available? If there's an insurance, if you have health insurance through your library, sometimes there's an employee assistant program that we would encourage people to look into prior to an event happening. And then the last step is looking to offer community engagement and programming options. One of the key findings from all of this work, and truly with libraries in general, is that there is no one-size-fits-all solution. We really want to encourage people to find a program that they can implement that works with their staffing expertise, with the partners that they have available to them, and make that available to the public in a way that makes sense for your community. This is one of the quotes that a frontline staff member at a partner organization shared during our interviews, and they really wanted to share that they hope that this study, the research that was funded, is another piece of proof that this is something that we need to do. And from what we heard from community members, from the library staff who were responding, and the partners, this has been so successful and so impactful in the communities that we really hope everyone will take the opportunity to see how they can fit into this response.